I remember an incident where a gentleman brought his 2, 3 year old small child, his son, for examination. And he came and said that, Doctor, my son has not opened his eyes for 7 or 8 days. So I don't know what's wrong with him. I said, okay, let me check. So I went ahead and tried to open his eyes and try to examine him. But he had closed his eyes so tightly that it was really impossible for me to open his eyes and examine him. So I was wondering what I could do. So I just gave it a thought and I thought about one trick. When I go and work in UK in the NHS hospitals, many a times when I come back, I buy some medicines, some eye drops, which are not easily available even in Pune. I carry these medicines specifically to use them in Arunachal Pradesh. One of such medicines is what is called as a preservative-free local anesthetic drop. It just makes your eye numb within seconds of putting that in the eye. So I always carry that. So these are the preservative-free drops. So I told Naina that Naina, just somehow you should manage to put one drop in his eye. And I said, what you can do is just pull down his lower eyelid. Even if he tries to squeeze his eyes, there might be a little small gap in which you can let at least one drop go in. And I said, after 5 minutes, repeat one more drop. And in the meanwhile, I'll try to see a couple of patients. So I turned around and she somehow managed to put one drop. In 5 minutes, she put the other drop. After 5 minutes, when I had seen a couple of patients, I turned around and this young lad, he had opened his eyes. So I could examine him. And what did he have? He had significant dryness of his eyes. The eye, instead of that bright luster, it becomes what we describe in ophthalmology as a fish tail sign. So his conjunctiva, or the white part of the eye, looks like fish skin. Also, cornea, or the part which you can touch with your finger, that's the transparent crystal clear part of your eye, the frontmost part, cornea, that had become cloudy and there were something like scratches on it. And because of those scratches, you get intense pain and you are extremely sensitive to light. You can't even tolerate ordinary sunlight. So he was squeezing his eyes and shutting them tightly. This is called photophobia. And what is the reason for that? The reason is vitamin A deficiency. We don't see that kind of deficiency in the rich Western states of India. I had learned about it in maybe my college days when I was
university
in ophthalmology, seen a few patients in small villages nearby Pune, but not seen in 40 years. So he had vitamin A deficiency. And the treatment, simple. We took him to the primary healthcare center where we were working. I told the doctor to give him an injection of vitamin A and then supplements of vitamin A to carry on. I feel blessed that I was there on that particular day to examine this child. If his treatment was not started, his cornea would have become opaque and he would probably lead a life of a blind person through his life. But with a simple treatment, we could avert that. We could rectify the problem. So many people ask me, what is the memory when you talk about Arunachal Pradesh? Is it the sunrise? I said, yes, of course, it has to be sunrise because Arunachal Pradesh gets the first sunrise. Sunrise is my memory of Arunachal Pradesh. But more than that, it is this sunrise, S-O-N, sun. That sunrise is my most favorite memory of Arunachal Pradesh.